Hey everybody, I'm back. It's now 3 o'clock in the afternoon, and I'm back to you live after our ileocecal valve checking day. Today was really busy in our office. I had a tribe of little people that kept me moving. I didn't check as many people as I would like, but I hope that maybe tomorrow or Wednesday I can do some more. But I did want to tell you about 3 people who I checked today and what the results were, because I thought it was kind of cool. The first person I checked with is a patient who reported with Bell's palsy. And if you don't know what Bell's palsy is, it's a neurological disorder where one side of the face kind of droops down like this. And the reason for it is several things. One is it can be a compression of the facial nerve where it exits the skull. Another reason can be a viral infection. And it also happens when the face has been bombarded by cold or a quick change of temperature. Anyway, so it makes it very hard for the eye to close on that side. Everything droops, the speech is slurred, and so forth. So this poor gal came in with this today. So what did I do? Well, first of all, I had to explain to the patient what was going on. She was prescribed antibiotics because it was thought she might have an ear infection. She was also given antiviral because she had a lesion on her face they thought might be related to shingles. And she was also given prednisone, which is a steroid, to help calm down the inflammation to the facial nerve. So all that's kind of cool, and for her medical doctor to look at. And from my point of view, what I did was to actually examine the cranium itself and to see if there are any areas where we could decompress the facial nerve. So in fact, I used applied kinesiology to diagnose a cranial inspiration assist, where we were actually able to manipulate the cranium like osteopaths do to create less pressure on that side of the face. The patient also has Lyme's disease or chronic Lyme's disease, and so we did some special checkups using another kinesiology technique to see if we could hunt any of that down. I didn't seem to find anything that told me that maybe she was having a reactivation of the infection, but her medical doctor is also going to check in on that. I did check both the ileocecal valves and the valves of Houston on her. Why? Because, here's a person who's really stressed out. Bell's palsy is not fun at all. It doesn't feel good. You look funny, and you don't know if it's going to go away. So she had a lot of stress. She has a history of infection. She's overweight. So I thought, hey, let's check it out. So actually on her, in fact, both the ileocecal valve and the valve of Houston were both stuck shut. And so I basically did the very gentle massage-like, milking-like motion on these valves to get them to open. It was very tender on her. Also did the neurolymphatic points, also adjusted her. And we let her go. She felt a lot better afterward, and I advised her just to keep going with the advice of her medical doctor, and also possibly seek out a TENS unit to help twitch the muscles of the face so that they don't atrophy. So that was the first patient. The second patient that we saw today was a little bitty guy. He is about a month old, bless his heart, and he has a very stern expression like this because he doesn't feel well. Mom had a really great natural birth with him. All that went well, but he's very fussy. So lots of gas, difficulty passing stool and gas, and just a sad little guy. So anyway, I checked him chiropractically. I adjusted the atlas and occiput, which are major areas that control the tone of the gut. Also checked the pelvis, the sacrum, got that adjusted as well. And also did my thing with the ileocecal valve and valve of Houston. So with a baby, you can't do muscle testing because they don't know how to hold their arm there. We can't get a clear muscle response, so I had to just do it by palpation, meaning by diagnostic touching. So both of the areas were very firm to the touch, and he really didn't like it very much at all when I did that, but I just very gently milked the valves, and I also used my percussor, which I don't know if you can see it over there. It's that instrument. I'm going to show you right now. Hold on. Right here. This is called a percussor, and it makes a vibration. You can see my hand wiggling here, and it's really terrific for helping to release fascial restrictions. So I just put it right over the valve on both sides, and guess what happened? Well, he calmed down. So vibration is a really helpful way to block pain as well as release fascial restrictions. And he was able to relax, and he was happy to go and be in his mom's arms afterward. So that was really great. So there's another example of how we can use corrections to these valves to help move things along. By the way, for homework, I gave Mom some instructions, right? We talked about diet. So number one, is I told Mom to really avoid dairy. Dairy is a major cause of gas in babies. And I happen to know from her family's history and some of her siblings that just about all of them have sensitivities, intolerances, or even allergies to dairy. And although she doesn't eat dairy very much, she still uses butter. And I said, you know, that's enough to create an intolerance in a baby. So she's going to stop doing that. She's going to drink a lot of water and also take some probiotics herself, and maybe just give him a little bit of probiotic as well to help support his microbiome. So that was that whole visit, and included the ileocecal valve and valve of Houston. The last of the 3 patients that I saw was a lady who has hip pain. The patient is somewhat overweight, she has diabetes, and she has hip pain. And she's really doing a great job of getting to be walking more and being more active, but it's really been like this pain has been present for quite some time. So before, I was really checking the strength of the hip flexors, abductors, adductors, correcting the position of the pelvis, and it would help her, but it doesn't always stay. The correction doesn't always stay. So this time I was like, hey, let's check these valves on you and see how they work, right? So I checked them, thinking, well, you know, the ileocecal valve and valves of Houston relate to hip pain. And so we checked them, and actually on her, it was the valve of Houston. And we had talked about continuing some strategies along the way of clearing the bowel, like using bentonite clay, probiotics, and other things to get the bowel moving. So she had actually started on some of this stuff before, because I was thinking that perhaps the lower spinal nerves were being irritated by some bowel toxicity. So she was already partly on her way. So those are the 3 patients that I was able to check today using this applied kinesiology technique. It's always really great fun for me. I look forward to doing more of this and seeing what happens. So maybe I can take just a moment to see if there are any questions or anything. Does anybody have a question or a thought or anything? I'd really be happy to hear you. I see Miss Sandra loves this information, and thank you, and thank you for watching. I appreciate that. Does anybody have a question on any of this? Give it like 5 more seconds. So I'll keep reporting back about what I find in regard to the ileocecal valves and the valves of Houston. I'm not sure what my topic next is going to be this week, but as soon as I know, I'm going to share it with you. This has been fun. I hope you found it fun. If there's anything you'd like me to talk about, thought of, because there's so many topics in health, please you know, send me a little instant message and let me know what you think. So have a blessed day and keep your colon in good shape, and I'll see you soon. Take care. Bye now.